So hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. Okay, so in this session we'll continue the general orthopedics wala part that we have left in the previous lecture just 10 minutes ago. So we'll continue, and this will be the general orthopedics part 2. Okay, which will be very important for your concept building who are preparing for the NEET PG 2022 examination, and also for the final MBBS students going to appear for the prof and university examination. So currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. So before starting the session, I will just briefly guide you about our various subscription plans that are available on the Unacademy for NEET PG. The first one is your plus subscription. The plus subscribers will get access to an entire live as well as recorded classes. They can access an entire QBank, and they can compete in live tests and quizzes, all of which is found by the topmost faculty for the NEET PG in India. And also will allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also, for the subscribers who will be subscribing for 12 months or more, we are shortly providing them with a printed notes. And while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one is the iconic subscription, and as I've told you, it is the best subscription plan for the NEET PG across any digital platform in India. And what makes this the best is that, apart from the things that I mentioned earlier for the plus subscribers, that all you will get, and in extra me you will get the prep ladder and all of the prep ladder, including all of its QBank, the video lectures, rapid revision courses, grand test, etc. And on an academy extra you will get well structured live batch wise classes. And also we'll provide individual test assessment sheet to the iconic subscribers after every test that they give, so that they can analyze themselves, ki yes, this topic or this subject needs more revision. Yeah, what are the things that are asked frequently from this topic, what are the major words or pointers that are asked frequently, and how the questions are framed. And all of this is very important in planning for any competitive examinations, and the iconic subscribers will get all of this. And while subscribing for the iconic subscription, you can use my code. Wait, yes, you can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special. Please do attend these special classes, because they will give you extra edge over your competitors, and also you will get a live classroom like feeling, which is very rare in this COVID times. You can interact with your educators, you can solve your doubts there and there only. You can watch the special class anywhere, anytime. What you have to do, you have to just download the mobile application of Unacademy and log in into the mobile application using my code, that is Anshul B10. And both of these are absolutely free. And also, after every special class that you will attend, you will be provided with the digital notes of that special class. And please do solve a QBank. It is very good, because it contains every type of question that can be asked or that have been asked previously in any type of competitive examinations. Okay, it will the questions will cover your entire theory. They contains questions of the previous year, recall questions, the image based questions, the CT, X-ray, MRIs, the histopathological slides, the very important clinical based and the clinical scenario based questions. Okay, the recent advances. So every type of question, the match the column, etc. Every type of questions are included in a QBank. So please do solve a QBank. And also we have launched a new feature which is called as raise a hand feature, to make the digital platform more interactive and to increase the communication between the learners and the educators. So In this feature, you just need to tap on a button so that you can digitally raise your hand, and your educator will come to know about your doubt, and you can solve your doubts and queries there and there only in the live class. Okay, and also we are organizing a special NEET PG combat on 28th of November at 5 p.m. in the evening. It is a 45 questions, 60-minute combat test, which will be a live test. Okay, and based on the score and the rank of this test, you can win exciting prizes, Amazon gift vouchers, and also the scholarships worth 1 crore rupees plus. Okay, so please do participate in this NEET PG combat test, and for participating you just need to enroll, and you can enroll for this on a mobile application as well as the official site of the Unacademy. And while enrolling, you can use my code, that is Anshul B10. And remember, it is absolutely free. The test is absolutely free, so please do participate in the NEET PG combat, and you will have a great chance to win exciting prizes and scholarships. So these are the prizes and the scholarship that you can win according to the rank or the score that you score. And so only one day is left. Please do enroll, and it is absolutely free. And please do give a 60-minute 45 question live combat test to win exciting prizes. And these are the various subscription plans for the plus as well as the iconic subscriptions. Okay, and here you can see that the cost per month decreases significantly if you increase the duration of your course. Okay, so economically also it is beneficial, and academically also, you don't want to hop around and study different subjects or different topics from different platforms or different notes, because this will make your revision and concept building very difficult. So please do subscribe for subscription course with longer duration, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Okay, so let's start today's session. So we'll continue from where we have left. Okay, so so we have already discussed the boxes fractures. Now we were studying about the नाम वाले important fractures. So उसमें the next fracture is your side swipe fracture. Okay, so side swipe fracture, basically remember, this is an elbow injury or a elbow fracture. Okay, like side swipe ki, you are putting your elbow or hand outside the car window and someone has hit you from the back, the side swept by another vehicle. Okay, so there it is a combination of different fractures. First fracture is of fracture of the distal end of the humerus, with fractures of proximal end of either radius or ulna or both. Okay, and it is also called as the baby car fracture, the side swept fracture or baby car fracture. Okay, this is your side swipe fracture, baby car fracture. And there is one fracture which is called as the bumper fracture. So bumper fracture, when you are hit by the bumper of the car, so obviously it will be a commutated fracture due to high velocity trauma, and it is a fracture of the most commonly lateral condyle of the tibia. It is important that the fracture will be of the lateral condyle of the tibia. Now in ankle, what you have three malleoli. Okay, here you have three malleoli in the ankle: the lateral malleoli, medial malleoli, and the posterior malleoli. Lateral malleoli is of the fibula, medial and the posterior malleoli is of the tibia. Now, if any two malleoli are fractured, that is bimalleolar fracture, it is called as the Pott's fracture. Whereas if all the three malleoli are fractured, that is trimalleolar fracture, it is called as the Cotton's fracture. Here you can see in the image very easily. This is Pott's and this is Cotton's. Okay, now Meissoni's fracture. Meissoni's fracture क्या होता है? Ankle fracture में, if the force is in the supination external rotation injury, so what you will have, with ankle injury you will have fracture at the neck of the fibula also. Okay, ankle fracture with neck of the fibula fracture. Okay, so this is called as the Mason's fracture. Whereas Pillen's fracture is also a fracture or injury of the ankle joint where it is due to the vertical compression force, which is due to the vertical compression force. So here you will have a intra-articular fracture of the tibia as well as fibula, and it is comminuted. Okay, multiple pieces intra-articular fractures of the distal end of the tibia, and it have a very poor prognosis. It have a very poor prognosis. Okay, and what is aviator's fractures? Aviator fracture is fracture of the talus, and talus may be kiska, neck of the talus. Okay, and remember talus mein there will be high chances of avascular necrosis. Okay, so neck of the talus ka fracture is your aviator fractures. Okay, and chopard fracture dislocation. Chopard fracture is your fracture dislocation in the intertarsal joints. Okay, intertarsal joints जो होता है that is between calcaneum cuboid or talus calcaneum or the talus navicular. So वहाँ पे if there is injury or fracture dislocation, it is called as the Chopard's fracture dislocation. Okay, Jones fracture is of fracture of the fifth metatarsal base. Fifth metatarsal base का fracture is your Jones fracture, and it is basically an avulsion fracture. And what is avulsion fracture? Avulsion means टूट के अलग हो जाना. Okay, this is your avulsion fracture. Now Ronaldo fracture. Ronaldo fracture is your first metacarpal, first metacarpal के base का fracture, but it is extra articular. We have seen Bennett's fracture, first metacarpal base with intra-articular fracture. First metacarpal base extra articular fracture, it is your Ronaldo fracture. Okay, now here you can see this is your Mason's fracture, and if here there will be fracture of neck of fibula also with ankle injury. Okay, here you can see intra-articular distal end of tibia and fibula are fractured. So this is your Pillen fracture. Jones fracture, fifth metatarsal base, and next is your Jefferson fracture. Jefferson fracture is fracture of the C1. C1. Okay, that is this first cervical vertebra, which is also called as C1 vertebra, is your atlas. Okay, so C1 is your atlas vertebra. So atlas vertebra ka fracture is your Jefferson fracture, like this. Okay, now whiplash injury is a cervical spine injury. Okay, in the cervical region due to sudden, first there will be flexion, then it will be followed by the hyperextension. तो पहले flexion होगा, then followed by the hyperextension. So this is your whiplash injury. Now chance fracture is the vertebral column ka fracture, also called as the seat belt fracture. And in chance fracture the fracture line will pass through the entire body of the vertebral column. Okay, and the posterior part like the spinous process etc will also be fractured. So the chance fracture or the seat belt fracture is this. Okay, March fracture we have already discussed कि it is a type of stress fracture. Okay, this is your chance fracture. Stress fracture generally seen in case of second or third metatarsal, and it is very minute linear hairline fracture. Okay, and it is generally seen due to chronic repetitive stress in marching soldiers etc. Okay, now burst fracture is again fracture of this vertebral column, but here it is will be a commutated fracture, and it will not extend to the posterior part. Okay, it will not extend to the posterior part, but it will be of the vertebral body only, and commutated fracture. This is your बर्स्ट फ्रैक्चर। ओके, ये सारे नाम वाले फ्रैक्चर्स है, वेरी इंपॉर्टेंट। अभी ऐसा लग रहा होगा कि हाउ विल आई रिमेंबर, दे आर वेरी इजी टू रिमेंबर, जस्ट रीड देम एंड click the photographs or save the photographs or the take the screenshots of these x-rays and just watch them whenever you get time, like in every 10 to 15 days you can just take out 10 minutes, and 10 minutes may you can see this 30-40 x-rays and you will never forget them. Okay, and they are very important. At least one aisa question in every competitive examination you will get from the orthopedics. Okay, so this is your burst fracture. Now we'll come to the second, that is next, that is the clay Chevalier fracture. Clay Chevalier fracture is fracture of the C2 vertebra. Okay, T2 vertebra, where there is fracture, or it is again avulsion fracture of the spinous process of the cervical vertebra. Okay, most commonly C2. तो spinous process of the cervical vertebra का fracture हो जाए like this is called as your clay Chevalier fracture. Okay, place overlay fracture, and it is also common in case of hanging. Now dashboard fracture नाम से पता चल रहा है what happens if you are sitting in a car and there is accident, so due to sudden trauma, your knee and your pelvis will hit the dashboard, so there will be pelvic injury. So in dashboard fracture you will have the fracture of the acetabulum, that to its posterior lip. So acetabulum fracture associated with the posterior dislocation of the hip, very very important. Acetabulum fracture with posterior dislocation of the hip, which is called as the dashboard fracture. Now what is straddle fracture? Straddle fracture is a fracture of bilateral IPR and SPR, yani both sides के superior pubic rami and the inferior pubic rami are fractured. It is called as the straddle fracture. Okay, it is called as the straddle fracture. Now what is Malgagny fracture? Malgagny fracture is again a fracture of the pelvis. Okay, where there is combination of different types of fractures like sacroiliac joint or the pubic rami or the ilium fractures. In fact, acetabulum fractures are also seen. So more than one type of fracture in the pelvis, it is called as the Malgagny fracture. Now what is mallet finger? Mallet finger is this. Okay, so the distal interphalangeal joint जो होगा, it will be flexed and you will not be able to extend it at the DIP because there will be the avulsion injury at the insertion or attachment of the extensor tendons. Okay, at the base of the distal phalanx. So this is your mallet finger. Sorry, this is your this is your acetabulum fracture. This is your acetabulum fracture. Okay, and if it is of posterior lip with dislocation, this is called a dashboard fracture. यहाँ पे क्या है? There is no dislocation of the hip joint. Malgagny fracture associated with more than one type of injury. Here you have the sacroiliac joint disruption with fracture of the ilium with disruption of the pubic symphysis or the pelvic diastasis. Okay, this is your mallet finger that I have told you. Okay, this is your mallet finger. Now we'll come to another important type of fracture, which is called as the pathological fracture, and we have already discussed this. So pathological fractures are due to any pathology ki there is any pre-existing pathology or disease in the bone or any systemic disease which will make the bones weak. So any trivial or minute trauma will cause the fracture, which are called as the pathological fracture. Okay, trivial trauma or even spontaneously. And remember, these fractures are hard to treat and they are very hard to unite. Okay, treatment and union are very hard in case of pathological fractures. And the commonest cause of the pathological fracture is your osteoporosis. Osteoporosis is the most common cause of the pathological fractures, and in case of osteoporostic pathological fractures, most commonly affected fractures are of the spine, that too of the lumbar vertebra, and उसमें भी most commonly of the L5 vertebra. Okay, इसके अलावा you can have the neck of femur fracture in older age. Okay, or the Colles fracture again in the elderly population. Okay, and they are common in the elderly women. In children or young adult age group, the most common cause of the pathological fractures are any tumor of the bone followed by the osteomyelitis or bone infection. Okay, so in children it is due to bony cyst or chronic osteomyelitis, whereas in adult it can be again due to any bony cyst or giant cell tumor or another tumor, and in elderly metastatic tumor is the most common cause other than osteoporosis. Okay, so here are the different causes of the pathological fractures due to any inflammatory disease like osteomyelitis. Okay, due to any neoplasm, be it benign or malignant or secondary, or it can be due to simple or aneurysmal bone cyst, or some generalized diseases like osteogenesis imperfecta, Olier's disease, osteopetrosis. All these are hereditary. Or osteoporosis, rickets, osteomalacia due to vitamin D deficiency, scurvy due to vitamin C deficiency. Okay, multiple myeloma or Paget's disease of the tibia bone, or the fibrous dysplasia. So all these are common causes of the pathological fractures. Okay, so and एक और चीज ये important है कि many a times there is one question ki sir, mallet and swan neck looks same. In mallet finger you will have the in mallet finger you will have the pathology that there is injury at the attachment of the extensor tendons at the DIP joint, so only the DIP joint will be flexed. Okay, whereas in case of swan neck there will be flexion at the DIP, as well as there will be hyperextension. Flexion at the DIP to hoga, but there will be hyperextension at the PIP. Okay, so in mallet finger there will be no pathology, or there will be no deformity at the PIP. Okay, so it is very easy to remember, and देखने से भी you can very easily diagnose it. Okay, no worries about it. Now the treatment, yes, I was telling you of one thing, that most of the time it is like this ki you come to know about the main disease which causes the pathological fracture only after the fracture. Okay, so the like in many cases of osteoporosis, or even in GCTs, or localized bone cyst, you come to know about the bony lesion when there is pathological fracture. Okay, so treatment is very important, is your identifying the underlying cause of that pathological fracture, and second is your treatment of that fracture and prevention of further fractures. So according to the age, there are different common causes of the pathological fractures. Okay, it is very important. Overall, osteoporosis is the most common cause, and it is seen in elderly population, whereas okay, whereas in newborn babies at birth, or 0 to 5 years of the age, most common cause is your osteogenesis imperfecta, whereas in young adults most common cause is your less than 20 years mein osteomyelitis or the infection, and 20 to 50 years age में most common is your tumors of the bone like cyst etc. And after 50 years most common cause is osteoporosis. So remember 0 to 5 में osteogenesis imperfecta, 5 to 20 years of the age में you will have the osteomyelitis, 20 to 50 years of the age group जो होता है उसमें you have the tumors, and more than 50 years of the age group में you have osteoporosis. Okay, now diagnosis. Diagnosis is very easy कि with trivial force or without any trauma, spontaneously you have a fracture. Okay, so obviously that will raise suspicion, and when you will consult a orthopedician, he will easily diagnose it. Okay, so the treatment basically it is difficult because first you have to identify the cause, treat the cause, and by side you have to treat the fracture also. And the bone is pre-existingly weak, so that makes the union and healing difficult. Okay, and it's maybe the most difficult healing is that of the metastatic bony lesions, and they almost never unite. Okay, so metastatic bony lesions ki healing is uh, poor, whereas in case of osteoporosis obviously as compared to a normal individual the healing will be delayed, but healing is pretty good, and yes it takes time but healing is there and the chances of non-union are rare. Now injuries to the joints में basically injuries दो type की होती है, one is your subluxation and second is your dislocation. Okay, now subluxation and dislocation क्या होता है, suppose this is a joint, okay, and this is one bone, this is one bone, both are articulating and forming a joint allowing the movements. Okay, now if both joints become like this is your subluxation. At least there is some contact between the articular surfaces, but if both bones or the articulating surfaces of the joints are like this or like this ki they are not even in contact with each other, this is called as your dislocation. Okay, very easy to remember. Okay, now symptoms will be the same, history of trauma or fall etc., with pain, swelling etc., and limitation of the movement. And obviously in dislocated joint the signs and symptoms will be more as compared to in the subluxated joint. And dislocated joint is an emergency, remember, a dislocation joint is an emergency, and the treatment is closed reduction of any dislocated joint followed by the maintenance in cast, slab or traction. Okay, sorry, this is your dislocation, and most commonly dislocated joint is your shoulder joint. The shoulder dislocation is the most common type of dislocation, and it may be anterior shoulder dislocation is the most common type of dislocation. Okay, now injuries to the ligaments. So basically remember ki ligaments ki injuries is called as the sprain. Okay, sprain is nothing but an injury to the ligament. Okay, now this is your sprain. Now another word is your strain. Strain is injury to the muscles, and muscles ही आगे जाके क्या बता देती है, टेंडन. तो इसको याद रखने में there are sometimes confusion, especially at the examination time में you get confused on these very little things. So just remember bubbly, that is BBL, that is bone to bone is ligament. So structure connecting bone to bone is your ligament, whereas muscle को बोन से कनेक्ट करने वाला है, और दी लास्ट पार्ट ऑफ द मसल विच कनेक्ट टू द बोन इज योर टेंडन. ओके, तो बोन टू बोन इज लिगामेंट, एंड लिगामेंट की इंजरी को यू कॉल इट एज अ स्प्रेन, whereas tendon or muscle ki injury is called as a strain. Okay, now sprain are of 3 degrees or 3 types: first degree, second degree, third degree, obviously on the basis on the intensity of the damage to the ligament and its fibers. So in first degree, obviously there will be tear of only few fibers, so the signs and symptoms will be very less. In second degree, you will have more than, in first degree generally less than 20%. In second degree you have around 50 to 60%, and more than 90% is your third degree sprain, where there is complete tear of the ligaments, and there is a great limitation of the movement, and weight bearing in case of lower limb or the movement of the joint is almost absent in case of third degree sprain. Now sprain को identify करने के लिए you have a very important test which is called as the stress test. So stress is nothing but to give the stress to the injured ligament. Okay, so if for example, if your knee ligament is injured, okay, and you are suspecting anterior cruciate ligament की injury, so anterior cruciate ligament का function क्या होता है? It prevents the anterior dislocation of the knee joint. Okay, so you will try to push the knee joint anteriorly or towards the anterior side. Okay, so that is your stress test. Okay, and if there is excessive pain while doing that, or the knee can be dislocated anteriorly, that means your anterior cruciate ligament is injured. Okay, so similarly in the photograph it is shown about the medial and the collateral ligament. So medial collateral ligament का function क्या होता है? medial collateral ligament का function है the abduction. Okay, so abduction or the eversion of the foot जब आप करोगे and there is pain, यानी there is excessive stress on the medial collateral ligament, and अगर उससे pain हो रहा है बहुत ज़्यादा, यानी there is some injury to the medial collateral ligament. Okay, so in ankle injuries you have different types of injuries based on the direction of the force or the direction of the twisting and the bending, and these injuries are classified and the on the basis of this force only, and this is called as your log Hansen classification. And इसमें the most common type of injury is your inversion injury. Okay, inversion injury, it is your most common type of injury, and in inversion injury obviously foot is inverted, there is inversion, so the pressure will be on the lateral collateral ligament, so lateral structures will get teared and there will be injury to the lateral structures of the ankle. Okay, now pathology can be in tear can be in the mid substance, that is ligament के अंदर proper. Okay, or there will can be small avulsion also. Diagnosis is very easy. Diagnosis of any orthopedic injury, be it fracture, sprain, strain, it is very easy. First of all, you have to take the history of the patient, and the patient will give you history of any trauma or fall or assault, etc. Then you have to see where there is pain, where there is tenderness, or where there is swelling, where there is limitation of the movement, deformity, etc. Then you have to go for the x-ray or the MRI of that region. So then you will have to correlate the history, the examination की findings with the findings of the x-ray. Okay, So this, in this way, you can very easily diagnose any orthopedic injury. Okay, so clinical examination I have already told you कि क्या होगा, and stress test we have already discussed कि what is stress test. Investigations we have discussed. Stress x-ray क्या होगा? Stress x-ray is nothing but जो stress वाली position है उसमें you do the x-ray. Okay, and treatment in any orthopedic injury, you firstly the primary treatment is RICE. Okay, now what is RICE? I for R for rest. That is, you keep the limb immobilized, you give the rest. Okay, I for ice therapy, that is cold fermentation. Okay, C for compression. Okay, C for compression, any compression bandage, etc. And E for elevation. Okay, you elevate the limb. Okay, so you always follow this RICE, remember this. Now injuries to the muscles and the tendons, it is called as the strain. Injury to the muscles and the tendons is called as the strain. Okay, and it is more frequently seen in case of young people. Okay, and rest is the basic treatment of choice, because surgeries and all are done only if you are any sports person, you need bilkul perfect uh, working, or if the injury is very intense, or yani there is complete avulsion, etc., then you go for the surgery. So rest, analgesics and proper physiotherapy is the treatment of choice. Okay, um, now we'll come to the next part, that is the blood supply of the normal bones. Okay, we'll come to the blood supply of the normal bones. Now the major blood supply is from the nutrient artery. So what is nutrient artery? What happens is that the arterial supply जो होती है from the periphery, उसमें there is one single major prominent artery which enters the diaphysis or the medullary cavity, and then it divides into medullary branches and other branches. This is called as the nutrient artery. Okay, periosteum के अंदर there is periosteal vessels, which we have already discussed, and they are very useful for the blood supply of the bone. Okay, and they supply roughly the outer 1/3 of the cortex. Okay, now at the metaphyseal region there is metaphyseal vessels, at the epiphyseal region there is epiphyseal vessels. So metaphyseal vessels जो होती है, these are the most common site of infection or osteomyelitis, because here the vessels are arranged in hairpin shaped loop. Okay, so tuft of the vessels होता है, blood supply is very large, यानी increased blood supply, hairpin shaped loop, but the speed is very less. Okay, so speed less, यानी there is sluggish flow, यानी there is sluggish flow. So that's why there are high chances of septic embolism to get dislodged here, and there are high chances of infection in the metaphyseal vessels. So that's why most common site of osteomyelitis is your metaphysis. Okay, most common site of osteomyelitis is your metaphysis. Okay, so remember this key, this is the blood supply of the normal bone. Now we will read about the fracture healing. Okay, so how a normal fracture heals. Okay, so fracture healing is somewhat similar to the healing of a normal wound. Okay, normal, like the healing is with the fibrous tissue, except but here this soft tissue heals with the fibrous tissue, whereas here the fibrous tissue needs to get calcified, so the healing is with the calcification or the new bone formation. So here the mesenchymal tissue is mineralized, so the healing is with the mineralized mesenchymal tissue. So stages of fracture healing is similar, like there will be hematoma formation, okay, followed with the formation of the granulation tissue with the polymorph nuclear neutrophils, lymphocytes, etc. Then very important and the characteristic feature is the stage of callus formation, that is new bone formation. And this is the stage of callus formation is the first sign of healing which is seen on x-ray. Okay, which is seen on x-ray. So callus formation is very important. Then there is stage of remodeling and stage of modeling. Okay, so earlier this remodeling was called as consolidation and modeling was called as remodeling, but now the names have changed. So stage of remodeling, then stage of modeling, and both these takes years to do, remodeling and modeling, and both of these are very good in case of children. So that's why most fractures can be managed conservatively in children. Even a like there is one fracture here. So this fracture is the fracture line is reduced. Okay, the fragments are reduced. But if the fragment is like this, so this has to be managed surgically in an adult. But even this type of displacement can be managed conservatively in children because of very good remodeling and modelings. Okay, so that's the use and benefit of the remodeling part. Okay, so stage of hematoma, नाम से पता चल रहा है, it occurs just after the injury, that is in less than 7 days. Then धीरे धीरे there is accumulation of the cytokines and the polymorph nuclear neutrophils, lymphocytes later, leads to the formation of the granulation tissue up to 2 to 3 weeks. Okay, so with this granulation tissue you will have proliferation of the vessels, fibroblast, and very importantly osteoblast also. And after this there will be starting of the new bone formation in the form of callus, and it takes 4 to 12 weeks. So first sign of healing of any bone is the formation of callus, uh, and it's which is seen in the x-ray at least 3 to 4 weeks after the injury or after the fracture. So there is mineralization of these granulation tissue. Now remodeling and modeling. Okay, in remodeling and modeling क्या होता है, it takes years. And in remodeling, first of all, this callus is remodeled, and it is callus is still immature or the woven bone, whereas in remodeling this woven bone and callus is replaced by the lamellar or the mature bone. And in modeling, the endosteal and the periosteal surfaces are modeled in such a way so as to give the basic or the earlier shape of the bone. Okay, so this is your modeling. Okay, so here you can see hematoma formation in the first week. Then in till 10 days or 1 to 2 weeks you will have the granulation tissue. Then there will be callus formation. In starting 2 to 3 weeks you will have the soft callus. then in 3 to 4 weeks के after you will have hard callus, yani there will be calcium salts. Then after few years it will take the bone to remodel and then modeling. Okay, so this is your fracture repair की सबसे पहले inflammation होगा, then proliferation and new bone formation, and with this you will have the chondrogenesis, that is cartilage formation that are torn or that are injured. Okay, then you have the remodeling. This is your fracture repair. Okay, this is your fracture repair. Now stage of hematoma, we have already discussed. Now ये blood या hematoma आता कहाँ से? Obviously if there is injury in the bone, the blood will leak out through the torn vessels and it will form the hematoma. And remember, this hematoma is very important for healing, so you don't want to touch this hematoma, because in this hematoma only granulation tissue will form and here only the callus will start. So hematoma formation is very important. So that's why you but in surgeries what happens ki you open the fracture site, the hematoma is released. Okay, so nowadays there are special type of surgeries which are called as MIS surgery, that is minimal invasive surgery, where fracture site is not opened, so hematoma is not disturbed. Now how is this possible? Okay, so let us understand. See, if I have a fracture of this bone here, I have a fracture of this bone here. So one जो normal procedure होता है, it is that I will give a incision here, I will open the fracture site and I will put a plate after reduction here, then close it. But in this the hematoma will be released. And the another newer method is the MIS surgery, in which if the fracture site is here, I will not make an incision here, I will not open the fracture site, I will make an incision here, I will make an incision here. Okay, dissect and put the plate here under the IITV C-arm or the image intensifier, and I will put the screws here and I will not disturb the fracture site. I will just reduce it by proper manipulation and traction, etc., and fixed in the reduced stage by giving incision here, not giving an incision or not opening the fracture site, not disturbing the hematoma. Okay, this is your MIS, that is minimal invasive surgery, and that is the use of hematoma. Okay, now stage of granulation tissue. Granulation tissue 2 to 3 weeks tak hota hai, and the sensitized precursor or the daughter cells, they differentiate, they proliferate like the blood vessels or the vasculogenesis, angiogenesis, it is called fibroblast, osteoblast, etc. Okay, so the fracture fragments के बीच का जो space है, it is obliterated by this, and फ्रॉम दिस स्टेज यहाँ तक तो क्या है, कॉमन है दोनों में, सॉफ्ट टिश्यू एंड दी बोन. बट आफ्टर दिस स्टेज या फ्रॉम दिस स्टेज दी हीलिंग का पैटर्न डिफरेंट हो जाता है, बिकॉज इन बोन दिस ग्रैनुलेशन टिश्यू इज इन सॉफ्ट टिश्यूज इट इज रिप्लेस्ड बाय फाइब्रस टिश्यू जिससे स्कार बनता है, whereas here there will be calcification. Okay, there will be callus formation or the osteoblast formation. In stage of callus formation 4 to 12 weeks हो जाता है, it creates the osteoblast. And remember, as we have discussed, this is the woven bone. So first sign of union visible on x-rays is in the form of callus, and at least 3 to 4 weeks it takes. Okay, and remember, the callus formation is slower in case of adult as compared to children, and also the callus formation is slower in cortical bones, whereas callus formation is earlier. That means healing and union is earlier and more easy in case of cancellous bone. Now stage of remodeling, which was earlier called as stage of consolidation, whereas the woven bone is replaced by the mature bone or the lamellar bone. Okay, it takes years, and इससे भी बाद में it there is modeling which was earlier called as remodeling, कि जब lamellar bone आ गई तो अब normal shaping of the bone is there. Okay, the endostal and the periosteal surfaces पहले जैसे smooth होगी या पहले जैसा जो shape है bone का, it takes into this. So this is more conspicuous in children obviously, and especially in the angulated fractures. So even angulated fractures like this, after few years in children you will see that कि वो बिल्कुल proper earlier bone, linear bone या earlier normal shape में आ जाता है, and this is due to the great modeling seen in case of children, and it is limited or it is decreased in case of adults. Okay, here you can see एक्सरे इमेजेस फ्रैक्चर है. ओके, डिस्प्लेस्ड फ्रैक्चर है. नाउ 7 days पे यू कैन सी कि धीरे धीरे देर इज सम प्रोलिफरेशन, एंड एट द 2 to 3 weeks you can see that there is formation of the callus, and after 6 months you can see that it has united with great remodeling. And see, we are talking about years, but यहाँ पे तो 6 months में ही remodeling and modeling हो गई, because here you can appreciate कि this is an x-ray of a child. Okay, so children में इतनी अच्छी remodeling होती है, इतनी अच्छी healing होती है. Okay, but in adults क्या होता है, you need to reduce it or maintain it in the reduced state, so you use implant, so it will approximate and there will be great healing and union of the fractures. Okay, union of the fracture. Okay, so now we'll continue the lecture, that is healing of the cancellous bone, and आगे का general orthopedics in the next class, which we'll start in again 5 to 10 minutes only. वहाँ पे we'll try to complete this general orthopedics, and if we will get the time we will discuss the MCQs or the multiple choice questions, otherwise we'll discuss them in the next classes. Okay, so please do attend my next lecture, and it heading of the next lecture will be MCQs of the days. So we'll try to do the MCQs, but first we'll complete a theory part for today's class. Okay, ज़्यादा नहीं बचा है, and we will try to do some questions also. So see you in the next class in just 5 to 10 minutes. Okay, link is given in the Unacademy page of the YouTube, or you can see it in the suggestions. The topic will be MCQs of the day. The topic will be MCQs of the day. Okay, so see you in 5 to 10 minutes. Bye bye.